Oh, welcome. I'm glad that so many people are interested in the topic of pushing a button and getting emotions out. I'm a researcher at the Fraunhofer Institute. How can we design AI to be explainable, but also sort of caring for people? Now, I'm not the only one interested in machines and AI. One example is The Sandman by E.T.A. Hoffmann in 1816. And this is about Nathaniel, who falls in love with Olympia, who's the daughter of his professor, who later on is revealed to be an automaton, a wooden puppet, which really makes him crazy. I'll spoil you. So for the first time, they meet for the first time at a ball. He dances with her, and she always says, ach, ach. So he interprets this to be, well, this is a person with very deep waters who understands him very well. But in actuality, she can't express herself very well because she is a machine. Today, we're experiencing these kind of machines as well, and we're interpreting their behavior as well. I brought two videos with you. The first one is from 2016, a robot from Boston Dynamics. Let's look, how does this sort of, what are your emotions when you're watching this? Who was feeling for the robot? I can tell you, I saw this video in my computer science class with many different computer science students, and all of us felt like this. Now, originally, Boston Dynamics actually wanted to show how much they were able to develop the sensors of the robots, how the robot was able to respond to sort of changes in the environment. So a very technical thing. But it actually causes an emotional effect in us. A second video that I want to show you is something from 7 months ago from Disney Engineering. So who has more of a positive impression of this robot? Who thinks he's pretty cute, maybe? Well, I also did. Why did Walt Disney's developers present this robot? They said they wanted to really show different ways of moving and how movement can really portray personality. So that means I, as a researcher, can tell you these robots don't have any emotions, but as Kate Darling really has said, we are really far away from developing robots with feelings, with emotions, but we already have emotions for them. Now, what exactly are social robots, which is the topic of my talk today? Social robots are designed so that they interact in a natural, really human-centric way with people to really to cause positive results in different areas. And today we're going to be talking about nursing and care work, especially in the medical area, so like nursing in terms of in medicine. So what can they do to really cause these positive results? So there's a couple of them. There's Garmi, who's a nursing robot researched at the TU Munich. Or someone, Riba, who can actually lift people into their bed. We can use these robots to surveil the sort of, to surveil health. We can use it as a database about older people, where you can, doctors are able to sort of store the information about these people in a very targeted way. You can also use them for cognitive training, for instance, after having had a stroke, or for aging, to sort of keep these kind of cognitive and also movement skills. And the last thing is to sort of social robots that are about social interactions, where this robot from Japan can play games with you and should prevent you from feeling lonely. Terabot, another system, a bot that has been active since 2012, which is a robot that assists therapy for children. Or another robot that is used for therapy for people with dementia and autistic people. Now, these are a lot of different tasks, and as many sort of different tasks as we are seeing, a lot of them are still in the research area, but the same way they have a lot of different tasks, they can also look very differently. I brought you some examples. Paro or Pepper, who has this tablet with him, but also some that have a lot of facial movement, some that are very similar to humans, that look like humans really, and how robots look, what impression they make on us. Masahiro Mori has really sort of investigated this and he called it an uncanny valley. So one aspect is how similar does this robot look to a human, and then the second thing is how much are we accustomed to this kind of look. So there's a really good curve that you can see, which in general, the more close to human someone looks, the more sort of close we're feeling to them, the more common they're looking. But there is a really a sharp drop, which we call the uncanny valley, where the robot looks very similar to humans, but actually in sort of a subtle way doesn't behave like a human exactly, and therefore they really we really fear them. But what researchers are saying is when we have robots that we can't distinguish from people, then trust is back again. Now, should we have those? Well, many researchers say no, we should actually stay in a different area where robots aren't very similar to humans. And this is a quote that says that robots shouldn't look like humans, but they should look like tools. They should be designed so that they are well equipped to do their task, but not so that they're similar to humans. Now, how should this robot look? How many of you have a Roomba-like vacuum robot? So how many of you have given this vacuum robot a name? Okay, quite a few as well. This topic was also researched, and what was shown was their robot doesn't need to look similar to a human for us to create a relationship with this robot, to give them a name, to create a relationship, really. And the question is more, how should we design robots to use them best? And this is what this kind of human-centric AI is related to. This is an area that I research. Now, this is a new term, so there's a definition. Human-centric AI is a perspective on artificial intelligence and machine learning that really states that intelligent systems should be designed with the thought that that they're part of a bigger system. And this bigger system is really us people. So these robots aren't developed in isolation, but instead they will be interacting with people. So therefore, we should really look into what do people need, and sort of what kind of restrictions do we need. And in order to make sure that this kind of human-centric AI exists and is positive, we actually need to have two aspects. One of them is humans need to understand robots. The other one is robots need to understand humans. Now, I already told you I'm a psychologist. And let's take a step back. How do people understand other people? So, non-verbally, so without any language. Our face has a lot of different expressions. A lot of us can express emotions using facial expressions. And many of us can also see and really perceive these emotions using this kind of nonverbal and facial expressions. But we can also use arm movements and different ways of touching each other, for instance, to really express these kind of emotions. On the other side, I can also communicate verbally, for instance, using spoken language or other types of language. And this kind of spoken language is really essential for us to be able to understand, to be able to explain what we're doing, what are we thinking, why did we do something. So these explanations are really important. And a researcher in 1978 by Ellen Langer really sort of researched how important are these explanations for people's interactions. Now, back then, they had a copier, and there was a queue of people who were waiting to copy something. And there was a trial patient who wasn't aware of sort of the experiment at all. So, and there was a person who really wanted to print something, and a person who was aware of the experiment. They walked up to it and they said, "Hey, I really need to copy something," and sort of tried to skip the line. Now, in one part, they said, "Sorry, I have 5 pages. May I use the copier?" In the second group, they heard, "Sorry, I have 5 pages. May I use the copier because I am in a hurry?" And the third really heard, "Sorry, I have 5 pages. May I use the copier because I need to make copies?" Now, the third explanation is really nonsensical. Presumably, everyone who's standing in line needs to make copies, so it's not really that sort of special. It doesn't provide any additional information. And the result is really interesting. So in the first example, about 60% of people really allowed the person to skip in line. The second explanation, which might be the sort of most reasonable one, there were 94% allowed the person to skip the line. But in the third explanation, there was also a sort of 93% probability of them being left on. So explanations really are social. Just based on having explanations, our behavior already changes. And someone really looked into whether this is how we can apply this to robots, really. So what we asked people is to really speak a couple of words. And then we had this kind of information and an agent next to them that was there to really show them this spectrogram, which is really I guess, a visual way of representing what was being said. And this agent was sort of explaining what exactly they said based on either text information, based on giving spoken information, or based on being a virtual agent. And what we found was the more similar to humans this kind of agent looked, the more trustworthy it felt to many of the people who were part of it.
So some colleagues described a scenario where they had a care roboter. This is nothing that we can achieve right now, but it shows you how many aspects there are to consider. So imagine a care robot and a person. The person is just babbling something unintelligible, and the robot is thinking, okay, this is a situation I haven't encountered before, so what could I do? So in the research, it could try to assess different aspects, like, for example, the person is smiling, so it can't be too bad. They took their medication, so they're kind of healthy. It looks around the situation, so the room, and realizes there's a set of teeth on the floor, so maybe they lost their dentures, and then it could actually ask and also transparently try to explain it. I understand you're talking funny. Could it be because you lost your dentures? So what could we do that the robot in this complex situation could act in the way that we just imagined? Obviously, this is a fictional scenario so far. This is far in the future, but nothing we could do right now. But in order to enable the robot to do this, the robots need to understand humans. And that I want to show you the current state of the art for this aspect right now. So first of all, the robot needs to detect the emotions of the person. This is a video. This is an emotion detector of the University of Augsburg. This is Jackpot from MDR. It's a public news broadcast format. It shows a lot of small dots on the face. It tries to trace the muscle movements in the face, and it detects if the tip of your mouth moves up, then this has implications. For example, could be smiling, so it needs to detect all of this. It could also take into account something like where you're looking at, and this is already reasonably working well already. So we could say, is this done? I guess sort of. So this is an image I want to show you. So what does this image, what kind of emotional response does this evoke in you? Who thinks this is a happy or a positive emotion? And who thinks it's a negative one? The negative ones are in the majority. So who of you thinks that it's a negative emotion now? It's already was a lot of you, but it's more now. So if you have the context now, so you understand the person is in a medical examination and probably has pain or experiences pain. Okay, now let's change the context and let's see now who thinks this is a positive emotion. Of course, now a lot more of you believe this is positive, so you're not alone. This has been researched. So the facial expression alone doesn't help totally. You need the context to understand it correctly. This means context is important. We need to teach robots context, and this is already a great problem in research that is being worked on. So assuming that you can do this, and I gave you another example. I already see a fair amount of people who are smiling, and so let's look at the emotions and the context. So here there are people in a changing room. A lot of people are smiling. One doesn't. one person is on a set of scales and another one is putting a foot on it. So if I gave you this textual description of this, so you would say, okay, thanks for that, but doesn't speak to me. So what do you need is more context about the will. So this is just a small glimpse now. If you know that in our society it is often associated negatively if a person speaks publicly about their weight. So if someone is on the scales and someone puts their foot down on the scale as well, and the person is a lot heavier than they thought, and the person is going to be surprised that they're that much heavier, that might be slightly discomforting to them. But the person who puts the foot on the scale is not just anybody, it's the former president of Barack Obama. So politicians are usually associated with very serious topics. So all of these pieces of information that we have in our heads available on the fly, because we've seen Obama in different contexts, and we can project all of this information onto this image. But machines who don't have that context and the knowledge about the world, and teaching them that is the greatest challenge that we currently have. And we just know that we have to make humans understand robots, and we have to help robots understand humans. But then there's still the question of open, in order to make the most of robots in practice, in care work, what do we need to take care of? And for me, the most important aspect is that we shouldn't just design robots for people, but with other people. So we need to make the whole process in development accessible to people who may be affected, in order to take care of the needs that other people may have, and to better understand the scenario in which the robot will be utilized. And there was a study done by Shu Yuan and their colleagues with an enormous amount of other papers that they read and did a cross study. So in order to find out what aspects need to be taken care of when doing that, there should be human values. For example, the control should still be 100% up to the human involved in the scenario. We want a robot, for example, that reminds us to take a sip of water, for example, when they think we need to drink, but they shouldn't force us. We need to take care of the needs of patients and, for example, the well-being, the psychological and physiological needs that they may have. And not all of these needs should or can actually be taken care of by a robot. But also the staff is important. Their needs are also crucial. The robot should be a help to the staff. The satisfaction of the personnel, this can be shown in studies, is also very beneficial to the quality of care. So it should support these people and not be a burden. And what we need to know in order to avoid it being a burden is that you need to understand the scenario where the robot will be utilized. What kind of roles or tasks will the caregiver have, and which of these can the robot take over? And currently that's still very limited. And in addition, with the knowledge about where to utilize them, we also need to think about the costs and benefit. So how much does the robot cost? How often does it have to be put into maintenance? Is it actually economical to use them? And last but not least, we should think that it's not just about buying a robot, having it, utilizing it. It should also develop and evolve. It should become better over time. The staff and the patients should be able to give feedback, and that should be incorporated into how it works. Maybe the robot would be put to use for very specific tasks, and you then want to extend the usage that you have to other areas. And the robot should then be able to take that over, even if it hasn't been explicitly trained for that. So those are a lot of requirements, and as a spoiler, maybe one or two of you just came in here and thought maybe the will it take care of my parents in a couple of years when they need it? And clearly from research right now, we're nowhere near that state. We still have a lot of challenges left open. And what I want to give you as a conclusion, there is definitely not a button you can press and it will give empathy to the robots. We can teach them to detect emotions, but we need more than that. Our world is very complex. You need context, you need knowledge about the world. And what is very important is these robots will process the information, they will interpret it, but they will never feel. A robot that smiles back at me has no real empathy. He will not experience joy. It just responds with an emotional reaction that it's been taught. So more important is the question how we utilize them, how we will make use of social robots, how we want to design the scenario. Well, do we want robots as a social partner? Should it be as close to a human as possible? I personally shudder when I think about that. Shouldn't we rather think of them as a tool, as a machine that helps us in our tasks? And this kind of deliberation only works if you have the human-centric robot design where we discuss these kind of things and then take that into account. Okay, that was my talk. That was all for empathy at the press of a button. And if you're curious about what we do as the Fraunhofer Institute in Berlin, we're doing a lot of AI research. If you're interested in that, just check out our website. There's a lot to discover there. Thank you for your attention. Thank you.